Okay.
I just noticed that as I open the slide.
You are, unfortunately,
Yes.
this is what we got. I'm letting everybody in.
I have one quick question. So am I supposed to show the screen with the questions? Because if I'm scribing, I can't do both at the same time, right?
Okay,
I
then
only
it's
have
more,
one screen.
then it's more important to scribe, and the facilitators have the questions. So.
Okay, thank you.
Thank you. Okay, it is 5:31, and I'm going to share my screen.
Ok, son las 5:31, voy a compartir mi pantalla.
Okay, welcome everybody to the Alameda County COVID-19 Community Advisory Group. We want to remind you that you can participate in Spanish and in English. We also have live ASL interpretation and closed captioning. Could you repeat that, please, Pamela?
Ok, bienvenidos a todos al grupo de la comunidad para el COVID-19 del condado de Alameda. Quiero recordarle a todos que pueden participar en inglés y en español, y también tenemos interpretación para el lenguaje de señas americano en vivo.
Thank you. So I'm going to turn on interpretation, and we ask everyone to select English or Spanish on their screen below.
Y vamos a aprender el canal de interpretación, y queremos pedirle a todos que por favor seleccionen, ya sea en inglés o en español, el lenguaje de su preferencia.
Thank you. I'm going to start. All right, great. And okay. We remind everyone we have closed captioning, and for all of our speakers to speak slowly for our interpretation. Feel free to put questions in the chat, and we look forward to hearing from you. I will turn it over to our Public Health Director and one of the co-chairs, Kimmy Watkins Tart.
Good evening, everyone, and thank you so much for joining us. This is a special moment in our time together. We are pausing to allow ourselves the opportunity to reflect on where we are in the pandemic and what we really need to do together as a community moving forward to keep all our communities safe. And so we have a very different agenda tonight. We are going to spend most of our time in breakout groups facilitated by members of the advisory group to discuss what our strategy for COVID in Alameda County should look like moving forward. And so we encourage all of you to participate actively. We want to hear all your thoughts and your recommendations and your feedback, and to ask questions. Feel free to do that during any part of the meeting. I'd like to now turn it over to my co-chair, Nestor, who will introduce our partner updates.
Thanks, Kimmy. Good evening, good afternoon. Is it afternoon or evening? I never know when I'm, I just got back from San Francisco and I'm in that transition mode still. Before we get into a little bit of the updates, I do want to, on behalf of our other co-chair, Greg, he couldn't be with us tonight and he's recovering, and want to, thinking about him, and he's not doing badly or anything. He's just taking care of himself and just couldn't be here with us tonight. So just keeping him in our mind, and do want to turn it over to you all as part of this collective piece of our agenda, where we get to hear on some of the things that you all have been working on updates, lessons, and advice from you all. Uh-oh, am I frozen here? Okay, I I froze for a second. I want to make sure I'm still here.
Nope, we can see you and hear you.
Great, thank you. So who wants to kick us off with some partner updates? I know that you all have been working hard, and we'd like to hear from you all.
It's a quiet group today. This is Aaron Ortiz with La Familia, but I can't change the name, and it says Gabriela Gaciela, but in the spirit of partnership, I'd like to thank Street Level for their partnership with La Familia and the work that we've been doing in Fruitville and East Oakland, and continuing to vaccinate a lot of uninsured, undocumented families that are hard to reach on the street, and keeping it street level, true to our partners, Street Level. So just wanted to give them a shout out and say thank you for that partnership.
Thank you so much, Aaron. It did confuse me for a second, but now we have your name to match your voice. Any other updates from our partners, or anything, or maybe even a chance to express, some concerns that regarding, especially as we're all sort of watching the news and sort of keeping track of some of the changes, right? Are there any questions that folks may have? Now might be a good time to raise those as well if we have them, but really wanting to hear from our partners and what we're hearing on the ground in terms of updates, thoughts. Now is the time.
I guess I could offer some updates. This is Noha from Roots Community Health Center, and we are providing testing and vaccination and education around COVID, and also doing distribution of tests, rapid tests and N95s for the community. We're starting to sort of see the same thing that we're all seeing when we look at the dashboards and so on, which is this sort of the lull that we were enjoying for a moment there. Looks like it's kind of ending and creeping back up a little bit. A lot of our focus now is making sure that people who are eligible for treatment get that treatment, and that they know about that treatment. Also still working on getting people who are not vaccinated to decide to go ahead and get vaccinated. And we're still seeing people changing their mind all the time. I think it was important information that if you haven't been vaccinated yet, the recommendation for most people who are under 65 and who don't have underlying conditions is actually 8 weeks of spacing between the doses. We're noticing a lot of people haven't heard that news yet, and we think it's really important. And it actually has helped people change their mind, because they realize that we are looking at data, and that recommendations are being updated based on that data. So we found, just anecdotally so far, that information is actually serving to be persuasive for some people. So wanting to make sure everyone knows about that. Also trying to get the word out not to throw away those antigen tests based on the date on them, because a lot of them got an extension of 3 months. So to make sure that people know that those are still useful, and that they use them if they're getting any kind of symptoms. And I think now we're just also trying to make sure that we're all prepared going into what is looking like an uptick of cases, because this will be the first time we're going into a surge without the benefit of as much contact tracing. And so one of the things that we're hoping to get the community more broadly to weigh in on is, how do we best prioritize limited resources for contact tracing as cases start to tick up. So those are some of the things we're seeing and thinking about. Thank you.
Excellent. Thank you, Dr. Noha. That's helpful. I hadn't heard about the date. And in fact, I had a test and I said, I'm going to use it just in case, and I'm happy to hear that those are still valid and that they should be used. There's a quick comment in the chat that I'll read out loud for everyone. Yeri types in the chat, Korean Community Center of the East Bay with our coalition partners have been hosting vaccine clinics for limited English proficient immigrants and refugee communities, as well as collecting and analyzing data on what has made community members decide to get vaccinated and how they have been getting COVID related data. No need to apologize. Thank you for relaying that information to us via chat. Pastor Arlene, I see your hand.
There we go. Hey, so this will be, we'll get a chance to see if I've learned anything in the pandemic about technology. So don't hold your breath. But I just wanted to share that. Oh, can somebody give me screen sharing permissions? I have something really fun. I promise to be appropriate.
Working on it.
Okay.
Let's see. Let me know if it pops up.
That's funny, appropriate coming from a pastor. That was good. We appreciate it.
Haven't seen it yet. Okay, well, I'll start my little narrative here. Anyway, I have a fun thing to share if I get permission to do it. Anyway, with Eden Church is fortunate to be a part of 2 different coalitions. We have a lot of friends. We feel blessed about that. We're working with the coalition that Tiburcio Vasquez is the lead on, and the other one is a shared lead by RCD and La Familia. And our most recent major activity was to host a Children's Day celebration on April the 30th. That's Children's Day in Mexico. And we had a special guest, and I just wanted to show you our special guest.
Can you try it again, Pastor Arlene?
Okay.
It might be because we have the interpreter spotlight.
Okay.
Maybe. Or did it come up? I tried to make you a co-host.
Okay, nah, it's not working. Okay,
Oh,
anyway.
I'm sorry.
So everybody is going to have to use your imagination. I was going to show you either that or become my Facebook friend. That would work too. Anyways, I was just going to show you that we had the Easter Bunny was at our fiesta. And the bunny was super popular, and the bunny's got really good moves. It's just busting out the dance moves. And we had 250 families that were in attendance. 82 vaccines were shared, 240 food boxes, 200 toys. We have the best ones over here at our place. So anyway, just trying to, in the midst of a really stressful time for a lot of people, and it's hard to keep your chin up. We felt proud to be able to have a lot of fun while we were helping our neighbors. So we'll keep you posted on the next time. You won't want to miss.
Thank you, Pastor Arlene. And maybe we can just share that if it's a link that we can share it after
Sure.
we're all done here. All right. I think we might have a chance for just one last update from the field. Any last updates that we want to get before? I know folks are excited to jump into our working group. So. Okay. In that case, I will, let's see, turn it back over to, are we going to the county updates now?
We have an update from the Center for Healthy Schools and Communities. I think Kate is going to introduce the presentation.
Hi, everybody. My name is Kate Graves, and I work with Healthcare Services Agency's Center for Healthy Schools and Communities, and was invited here today to talk a bit about the School-Based Behavioral Health Initiative and the work that we're doing together to support students, families, and our school communities. So I don't know if folks are able to look at the PowerPoint presentation or how we want to work that. Great, thanks, Lauren.
And Kate, I'm just going to jump in real quick. Hi, good evening, everybody. This is Tueri. Kate's presentation is in response to last month's meeting where there was an inquiry as to what behavioral health work is happening in our county in schools. So we invited the Center for Healthy Schools and Communities and the Alameda County Behavioral Health Department, who have been working on the school-based behavioral health initiative. And unfortunately, our representative for SBBH, or the Behavioral Health Initiative, Lisa Carlisle, is double booked this evening, so she's unable to attend. But this is really such an important collaboration and very innovative collaboration in our agency. Thanks, Kate.
Yeah, thanks, Tori. Yeah, so I was happy to see so many familiar names and faces. And so many of you are well aware of all of the partnerships we have across the county. But the school-based, you can go ahead and move to the next slide, please. So basically the school-based behavioral health initiative, as Tori said, is a collaborative between two departments in Healthcare Services Agency, the Center for Healthy Schools and Communities and Alameda County Behavioral Health. And it started in 2009. And basically the mission is to strengthen and expand school-based behavioral health practice, finance, evaluation, and policy across the county. And I will say that our county really is unique in that we're really explicit about the links between health outcomes and education outcomes. And that is why our county has invested so much in our school-based supports. So as you can see, there's some different facts. And actually, we rechecked the number, and it's over $50 million annually that our county gives towards school-based behavioral health supports. So that includes our contracts with a lot of the community-based organizations who bill for Medi-Cal. That includes special education or education-related mental health services. So there's a range of services that includes, but we have a really large investment in our school-based behavioral health work. And I think you can go ahead and move to the next slide. So really our shared model, which is this innovative collaboration between Alameda County Behavioral Health and the Center for Healthy Schools, is oriented around prevention and wellness. And so we really enter into partnership with our community partners and our school districts and school communities with this lens of there are a lot of different ways to do this work. But really, the main focal points are related to the 3 tiers of support, which we'll talk a little bit more about in a minute. Building district capacity, so doing some of this translation around health and wellness work and education work so that we can really, this is a lot about working with the adults in our systems, right? A continued commitment to being culturally responsive and often transformative. Having a coordinated strategy, both at the district level and at the site level, so that our families and students aren't having to do as much navigation when supports are being offered. Really the idea that it's a school-wide responsibility to support the social emotional health of all students. It's not just about counselors and individual clinicians, it's about the whole team. That's what helps students do better at school. And also just doing an ongoing needs assessment so that we can understand what the strengths of students are as well as what their needs are. You can go ahead and move to the next slide. And so this slide just demonstrates is a visual for this idea of the multi-tiered systems of support. So this pyramid will look familiar probably to people in public health, and in terms of the idea that if we do certain things around prevention and promotion for our whole community, which includes fostering caring relationships, having high expectations, meaningful participation, we're not going to need as many higher end services. So we've invested a lot in this idea of tier 1 supports. And we also know that some students will need more. And so doing things like early interventions such as social skills group, case management, those kinds of things we expect about 10 to 15% of our students will need those supports. And then for really the highest, most intensive supports, we're looking at 3 to 5% if we're doing tier 1 and tier 2 well. So the goal of the school-based behavioral health initiative is really to sort of jigsaw together along with schools in innovative ways so that we can touch on all of these levels of support. You can go to the next. So as Tueri mentioned, we partnered with Alameda County Behavioral Health to represent the work of that department as well. And so, as many of you know, behavioral health is part of a larger managed healthcare plan that provides healthcare services to youth and their families who meet service criteria. So this is largely Medi-Cal. Largely, they're able to draw down from Medi-Cal and provide needed services at school sites in addition to in the community. But their school-based behavioral health programs really co-locate staff at sites to make them more accessible to families and also to work students and to work closely with the school community in service of improving outcomes for kids and families. So a lot of this work is done through contracted partners. Really, there's the sense that a lot of times our community partners sort of know best the communities in which they serve. So we're able to really be innovative about the work that happens in this way. And many of you may have heard of the coordination of services teams, which are the multidisciplinary teams that are school-based that we've really pushed forward across the county and use different dollars to support across the districts to look at who needs what. Really a sense that we're working together to figure out who has the connection with the student and family, who has the connection with the staff in order to serve the student as best as possible in a way that works for everybody. So you can move to the next slide. So once again, this talks a little bit about the different types of services that Alameda County Behavioral Health largely contracts for. So you see ERMS, the acronym in the first box, which is really, those services are related to when a student has an IEP and individualized education plan or qualifies for special education services. So there's a lot of investment in partnering around providing those services at schools. And then again, there are about 18 different community organizations, some of you on this call, who provide these services at our schools and in the community. And we work with 16 of the school districts across the county to provide these services. And largely the services funded by Medi-Cal or through Alameda County Behavioral Health are Tier 2 and Tier 3. So they tend to be more focused and targeted supports and services. And you can go to the next slide. And these are some examples specifically of the work that the Center for Healthy Schools and Communities does in schools. So you'll see a range of things. We just have more flexibility with our funding resources. So we're able to do more of that school-wide or district-wide work related to youth development, restorative practices, family engagement, which we have a large investment in, more of the typical student mental health support, group therapy, individual therapy, and social skills work, school staff support. So we know that a lot of our work is with adults in service of students in the school community. So we do a lot of training and staff wellness and workforce development in terms of internships and counseling staff. And then also a lot of work on building district capacity. So that's some of the work that gets systems in place related to things like crisis protocols, standardizing those across the system, mapping our resources so we know what students have access to, and then looking at where the gaps are so that we can build out more school health initiatives and really maximizing a lot of the community partnerships. And some of this work, I would say, has been crucial in terms of the COVID partnerships, right? The more that we can maximize those partnerships that exist, the more we can serve our community as a whole. So you can go to the next slide, please. And I wanted to just spend a minute on the systems integration work. So this is the work that happens across the larger systems, again, so that individuals don't necessarily have to do all of this navigation. We try to do this interagency collaboration across the system. So within healthcare services, we partner with public health, we partner with behavioral health and the Center for Healthy Schools and Communities. We partner with probation around student return to school. We partner with Alameda County Office of Ed, another place where the COVID collaboration was just crucial to the work that you all have been doing. And then school health centers. So there are a number of schools across the county that have school health centers that are really in service of integrating mental, physical, behavioral health on the campuses. And then a lot of work with our community-based organizations to, again, be at schools, serve community folks where they're at. And I will finally go into, next slide, sorry, to sort of funding and expansion opportunities. So one of the newest, these are the two newest things that sort of the state is investing. I mean, part of it is with the challenge of the last several years and the pandemic and all of the loss, there's been a recognition, I would say a heightened attention to the need for mental and social emotional health supports. There's been an increase in need, but also an increase in attention. And part of that has ended up in funding, which is good for us. It helps us move forward with the work that we've been doing and enhance it. So the Mental Health Student Services Act grant on the left side, the strategies that we've chosen to move forward with, and this is a partnership with the school districts and behavioral health and the Center for Healthy Schools and Communities again. They're very broad strategies, and we're in the process right now of planning with the districts and the departments to identify the specific deliverables, but they're really around the things that we mentioned before, creating healing environments in our schools, working on developing multi-tiered systems of supports, and youth leadership development, a real desire to have youth voice be at the center of what we're providing, because as we all know, folks who are receiving supports are the best ones to name what those supports should be. And then SBHIP, yet another acronym, the School-Based Health Initiative Program, is really around increasing the number of students who are enrolled in Medi-Cal receiving behavioral health services and working closely with the districts to enhance how we partner there. And a big piece of that is addressing the health equity gap and inequalities and disparities in terms of access, which I know is probably one of the reasons that you all wanted to hear more about this. So I think that is my last slide. Yeah, so I'm happy to take questions if there's time, provide more information if there's a need, but yeah, thanks for having me.
Thanks so much, Kate. That was a really important and helpful overview. And if there's any question, please put them in the chat, whether we can answer them now or later. And just a reminder that the slides will be available, when they get posted, so you can really see the more detail of some of this effort that is a long-standing effort of, Alameda County. So kudos to the work of the Center for Healthy Schools and Communities and behavioral health to support school-based behavioral health. Thank you. All right, are we going to the next slide then, Lauren? Because I think it's actually me.
It is you.
Okay. All right, well, good evening, everybody. It's good to be with you today. So once again, my name is Tuweri Anderson, and I serve as the Director of Systems Integration for the Healthcare Services Agency. And along with my colleague Pego, who is not here with us today, we have had the great pleasure of working with some of your CAG members to support our community engagement process for the COVID-19 strategy refresh. So we're going to take about the next almost hour to be in that dialogue with you all here. Next slide, please.
Let's see, sorry. Did I drop these in here? Ah, you see it?
Right.
Oh.
Yep, I see it. So the objective of this portion of the meeting is to ensure that the next Alameda County COVID-19 strategy is updated with all of our experience and wisdom, and particularly from our community partners and community members. Can you keep advancing, Lauren, please? Great. So thank you. There are 3 phases of this strategic refresh process. So this evening, and Director Watkins-Tart alluded to this earlier today, and then we talked about it last month. Tonight, we're going to review the high-level activities of the plan and get feedback from the community. So this is part of a multi-engagement process that will include our community members, stakeholder partners, our COVID division staff who are doing the services, and our funded partners doing services, along with our agency leadership. And the version of the strategy that you will receive has some edits. You will see this in a moment already from our COVID division. So we're really just going to focus on the high level activities. Next month at the CAG, we're going to use that meeting to discuss the criteria for how to prioritize our implementation strategies using a racial equity and community focused lens. The third step is to share all of these rounds of feedback with the COVID division, the public health department, and our agency leadership to help shape the next strategic refresh update by the summer 2022. You can advance, Lauren, please. Okay, so just quickly to share with you, so we're using similar definitions when we get to the strategy. So on the document that you'll see in the next slides, the goals are Alameda County population level health outcomes for the COVID-19 response. And I really want to highlight the population level health outcomes because some of us are doing work directly with small communities, specific communities or patients or clients. And some of those population level health outcomes aren't as specific perhaps as the outcomes that you are driving towards. So just to say that it is for the entire Alameda County population. And those goals are focused in 4 areas: prevention, disease containment, health disparities. Oh, good thing I can read.
Sorry, I gotta get through each of them. Sorry.
And public health infrastructure.
Did I go too fast? Oh no.
Yeah, you did. Actually,
I'm sorry. All right, I'm sorry about this. I should move all the. I apologize, everybody. Okay.
And then strategies, and Lauren will show. Oh, thank you, Wendy, that it's the 14th. You are correct, Wendy. It's the 14th, not the 13th. Thanks. Strategies in the plan are these actions to accomplish the aforementioned goals. And then the third part, which you won't actually see in the document, in the strategy document, is the implementation plan. And that is largely unseen and internal to our COVID operations teams. So just to say that that third part of the strategy is a lot of what we're going to talk about on the June 14th meeting. You can advance now, Lauren, please. So what you see here is just a pull out of the 4 goals, those population level health goals. Prevent COVID-19 infection, transmission, and serious illness. Test, isolate, and support care of people with COVID-19. Redress COVID-19 related racial ethnic health disparities. Strengthen, align, and evaluate public health infrastructure. The assessment thus far is largely these goals remain unchanged. Next slide. So what you see here are those same goals with the strategies underneath. I'm not going to go through all of the different strategies, and I know the text is very small. What I do want to point you to are the updates in red. These are additions from our COVID division. So what we're going to do, and you can advance to the Spanish language slide if you'd like, Lauren, so that people can read it. So what we're going to do in the next 50 minutes is we have a group of a small working group of CAG members who've supported designing this feedback process and the questions. We're going to break people into breakout groups, and we will have a member of the small working group facilitate that working group session. We will have a scribe from the public health department support taking notes, and the small working group facilitator will ask 4 questions of the group. Lauren, do you want to put the questions up just so that people can start thinking about them while I give instructions? So these are the 4 questions for you all to churn over the next 45 minutes or so. I'm not going to go through them because you can see them here, or maybe I will. Maybe that would be easier. First question, where are the places that community partnership needs to deepen in order to execute the strategies and achieve the goals? What are some examples of where strategies to reach communities with the lowest vaccination rates are working? What does vaccination success look like for Alameda County? What critical messages do communities want to hear from the public health department and the healthcare services agency regularly? So just as a reminder, these 4 questions are really looking at overall our strategies and success, not so much the criteria for implementation. That is a different conversation that we'll have in June. So right now, Lauren is going to randomly assign people to breakout rooms. HCSA staff who are not scribes will be sent to a green room. Anybody who will need Spanish language interpretation, translation, if you get placed in a room, please come back to the main room, which is where we will have our Spanish language breakout group. And group number 1 will be where our ASL interpreters will be. So if you need ASL interpretation and you are not in group 1, please come back to the main room and we will reassign you. Okay, Lauren, I think we're ready to go unless there's any outstanding questions.
No problem. I'm just naming group 1. Okay, I'm going to open the rooms now and they'll close in 40 minutes.
Thank you.
Thank you. Tueri, could you do me a favor? Can I throw you in Gary and Julie's? I think they'll, just to help them get set up.
Yeah, is Gary facilitating?
Yes, and
excellent. Sure.
Thanks. I'll just move you.
No
in there.
problem.
Thanks. All right.
Lauren?
Yes, Nancy. So Nancy, we had fewer rooms than scribes. Would you like to join another room in which you do not have to scribe?
Oh, whatever works for you, however I can help.
Okay, let me do that. I'll send you into a room to listen. Let's see. Okay. Emily, great question. I will move you to group 1, and I hope that it will work. Let's see. Hey, Aaron, whose room were you in? Who do you want to go back to?
I'm in Noha's room.
Is that cool, or did you want to go? You want
No,
to?
that's perfect. That's
Perfect.
perfect. I'm
All right.
switching from my phone to my computer, so this works
All,
out great.
all good. Let me move you back. Hey, good to see ya.
See you too.
You're in Noha's room. All right. How do I? There we go. Oh, are you already? Oh, there you are. Somebody else is in under your name too. Okay. Thank you so much for being here and taking the break. I hope. Oh, is he back? Shouldn't be.